Welcome to the Anemia Mastery Comprehensive Masterclass from ND Nursing Coaching, part of the Mission Selection Series for NORCET and AIIMS, presented by Mr. Nagesh Sir. Let's start with a fundamental concept. Anemia is clinically defined as a deficiency in which of the following parameters of the blood? The correct answer is B. Anemia is defined as a decrease in the number of circulating red blood cells, RBCs, the concentration of hemoglobin, HGB, or the hematocrit, HCT, reducing the oxygen-carrying capacity of the blood. Moving to morphological classification, the MCV, or mean corpuscular volume lab parameter, is primarily used to categorize anemia based on which characteristic? The correct answer is B. MCV measures the average size of the RBC. We classify anemia based on MCV as microcytic, normocytic, or macrocytic, which helps point to the underlying cause. Focusing on iron deficiency anemia, IDA, a patient with IDA will typically show which morphological features on a peripheral blood smear? The correct answer is B, microcytic hypochromic. Impaired hemoglobin synthesis due to lack of iron results in small cells and pale cells. This is the most common form of anemia worldwide. In clinical assessment, a patient's physical examination reveals koilonychia. This clinical finding is most closely associated with which type of anemia? The correct answer is B, iron deficiency anemia. Koilonychia, or spoon-shaped nails, is a chronic sign of iron deficiency. Other signs include pica, glossitis, and cheilitis. Regarding oral iron nursing care, when administering liquid oral iron supplements to a child, the nurse should use a straw to prevent what? The correct answer is B, staining of the teeth. Liquid iron can permanently stain tooth enamel, and using a straw bypasses the teeth. Remember to mix iron with vitamin C for better absorption. Let's discuss iron absorption. Which of the following substances significantly enhances the absorption of dietary and supplemental iron? The correct answer is C, ascorbic acid. Vitamin C. Vitamin C changes iron into its ferrous form, which is best absorbed. Avoid substances like tea, coffee, and milk, as they block absorption. Turning to pernicious anemia. It is caused by the lack of which essential substance required for vitamin B12 absorption in the ileum? The correct answer is C, intrinsic factor IF. Produced by parietal cells, IF binds to B12 to facilitate absorption. Lack of IF requires patients to have lifelong B12 injections. Which diagnostic test is used to evaluate the absorption of vitamin B12 and identify the cause of B12 deficiency? The correct answer is B, Schilling's test. This test uses radio-labeled B12 and a 24-hour urine sample to determine if the deficiency is related to diet, lack of intrinsic factor, or malabsorption. Focusing on neurological symptoms, unlike folic acid deficiency, vitamin B12 deficiency is uniquely associated with which clinical symptoms? The correct answer is B, neurological symptoms like paresthesia and ataxia. B12 is essential for myelin sheath integrity, and deficiency leads to nerve-related symptoms that folic acid deficiency does not cause. In pregnancy and folic acid, why is adequate folic acid supplementation prioritized for women of childbearing age? The correct answer is B, to prevent neural tube defects. Folate is crucial for DNA synthesis early in pregnancy. Low levels are linked to conditions like spina bifida and anencephaly. Aplastic anemia is characterized by the term pancytopenia. What does this clinical term mean? The correct answer is B, a decrease in all three major blood cell lines. Pancytopenia, resulting from bone marrow failure, causes low RBCs, low WBCs, and low platelets, leading to fatigue, infection risk, and bleeding. For procedures, which anatomical site is most commonly used for bone marrow aspiration and biopsy in an adult? The correct answer is C, the iliac crest. The posterior superior iliac crest is the preferred site due to its accessibility and safety. The nurse must apply pressure afterward to prevent hematoma. In hemolytic anemia, the rapid destruction of RBCs leads to an increase in which specific serum lab value, often causing jaundice? The correct answer is D, unconjugated bilirubin. When RBCs rapidly burst, the breakdown of hemoglobin releases heme, which is converted to unconjugated bilirubin. Excess bilirubin causes jaundice. The primary pathophysiology of a sickle cell vaso-occlusive crisis is triggered by which environmental or physiological factor? The correct answer is C, hypoxia and dehydration. Low oxygen or dehydration causes the hemoglobin S-containing RBCs to sickle, clump together, and blocks small capillaries, leading to severe pain and tissue ischemia. What is the top nursing priority during a sickle cell vaso-occlusive crisis to reverse the sickling process? The correct answer is C, restoring adequate hydration and oxygenation. Hydration is key as it reduces blood viscosity. Oxygen prevents further sickling. Pain management is also a core priority. Thalassemia major, also known as Cooley's anemia, leads to chipmunk facies. This facial deformity is caused by what? The correct answer is D, expanding bone marrow from compensatory hematopoiesis. The body's attempt to make more blood expands bone marrow into flat bones like the skull and jaw, causing these facial deformities. In chelation therapy, which medication is used in thalassemia patients to treat life-threatening iron overload, known as hemosiderosis? The correct answer is A, desferrioxamine. This iron chelator binds to excess iron, allowing it to be excreted. Patients should be informed that their urine may turn an orange or reddish-brown color during therapy. Patients with end-stage renal disease, or ESRD, develop anemia primarily due to the deficiency of which hormone? The correct answer is A, erythropoietin, EPO. The kidneys produce EPO to stimulate RBC production. In CKD, the lack of EPO leads to normocytic anemia, which is treated with synthetic EPO injections. In a blood transfusion, what should the nurse set the infusion rate to for the first 15 minutes? The correct answer is A, a slow rate, such as 2 milliliters per minute. Most severe hemolytic reactions occur within the first 50 milliliters, so the nurse must stay at the bedside and run the infusion slowly during this critical period. For transfusion safety, which intravenous fluid is the only one compatible with blood products during transfusion? Always use 0.9% normal saline. Other fluids like dextrose cause red blood cell hemolysis, and lactated ringers can cause clotting in the line due to calcium. Always use a filtered Y set with normal saline. A patient reports lower back pain and chills 10 minutes into a transfusion. What is the nurse's immediate first action? The correct answer is A, stop the blood. In any suspected reaction, the priority is to stop the infusion. Then, disconnect the blood tubing and keep the vein open with normal saline through new tubing. Send the remaining blood and a urine sample to the lab. Which of the following foods provides the highest amount of heme iron easily absorbed for a patient with anemia? The correct answer is B, liver. Iron from animal sources, or heme iron, is absorbed 7 to 10 times better than iron from plant sources. Liver is the richest source. Plant-based iron requires vitamin C for improved absorption.